If you have jumper's knee, patellar tendinopathy, and you experience patellar tendon pain with jumping, landing, changing direction, I suggest that you completely stop those activities. In a study by Jill Cook and others, it was titled Revisiting the Continuum Model of Tendon Pathology, What is its Merit in Clinical Practice and Research? She had this chart. It showed where pain is in the middle, and pathology is on one side, poor function is on the other side. And there's a little sliver at the bottom where you can have pain without having a pathology. I just had Jill on my podcast. I asked her about this little area, and she said that is probably wrong because their imaging was kind of not as advanced back then. So if you have patellar tendon pain, you probably have pathology. So what does this mean? Your tendon probably looks like this. Your tendon looks like this. What's happening when you're doing jumping, landing, and changing direction? Keith Barr says that the hole inside is like a Chinese finger trap. All the strength is on the outside, so as you pull your fingers apart, it compresses and doesn't let your fingers go. If we're talking about the tendon, this is compression on the hole, on the inside, and this compression is a stimulus for the cells to switch from tendon cells to more like cartilage cells, and cartilage cells absorb a lot of water. So that's your tendon can get very thick and full of water. If all you're doing is the fast activities, you're just causing more compression. You could just be causing your tendon cells to behave more like cartilage cells. That's not a good thing. So what you should do is use the viscoelastic properties. Do heavy isometric holds, sets of 30 seconds. It causes stress relaxation. Directional load goes to the cartilage-like cells and gets them to synthesize collagen in the right direction, gets them to behave more like tendon cells down the line. So you have positives for pathology and you have positives for pain, and it can get you back to sport. So if you experience a bad pain with your patellar tendon, stop the explosive activities. It's probably not good, and get in the weight room and do the heavy isometric holds, maybe heavy isotonics, until you can do the explosive stuff pain-free. Try it out. Enjoy.